Hi, my name is Richard, and I'm here to go over trach care competency. So for trach care, there's no standing orders. It's typically by the policy of your institution or per condition of the patient. So that's usually an indicator would be soiled um, gauze and other dressing, as well as a tie, and there's simply a lot of secretions that needs to be removed and cleaned. Once that's indicated, you go ahead and go to the chart and look at vital trends, any pertinent information like infections, when it was previously done, as well as the COCA of the sputum that was collected previously, and compare that to what you're going to be seeing. So that's color, order, consistency, and amount. You will also be looking at the patient's trach tube size, and you'll be getting one of the exact size and one smaller, and they'll be there just in case you need it. You would also be looking at how well the patients have done previously for trach care. So there's no true contraindications, though. Well, there are contraindications for trach care, and it's typically not trach care, but tracheostomy itself, and that's tracheostenosis, airway trauma, occlusion, aspiration around the cuff if it's not properly deflated, and those things that we should be looking out for. Once we've looked at our information, we go ahead and gather our equipment. We'll have if your student happens to have a trach care kit, now go ahead and pick one up. Otherwise, you can gather your own equipment. That would be usually some towels, number of gauze, lots of gauze, Q-tip applicators. You're going to need saline water as well as hydroperoxide. You'll need a new 4x4 to replace the old one, as well as a new tie to secure the trach collar. Finally, you're also going to need a replacement inner cannula, or if happens to have a reusable one that will be cleaned as we do the care. So once we gather our equipment, we go ahead and knock on the door. Hi, my name is Richard, and I'm a student with the respiratory care. We're going to be doing a trach care. It looks like you have a lot of secretions right there. It's a little soil. We're going to go ahead and clean it up, all right? You may have your name and date of birth. All right, sir. Mr. Brown, thank you. Check your wristbands. And I'll be checking the patient's room for safety equipment. On the head of the table, there should be an arburator. The arburator will help reinsert tracheal tubes that accidentally comes out. You're going to also check the ambu bag. And the ambu bag should be, once you include the opening, should remain inflated while pressing on it. If you depress it or deflate it, and include the opening, it should re-inflate, and you should check the duckbill one-way valve just to make sure it's functioning properly. Also, you're going to want to see the mask, and this is necessary just in case you need to bag the patient on the mouth if we need to, if the trach tube has been occluded. Once that's done, we're going to go ahead and do your assessment. All right, sir, so I'm just going to explain the procedure. We're going to be replacing your ties and your gauze. We're going to clean around your stoma site, your opening in your throat. There's potential hazards. It can make you cough, and it might cause a little bit of trauma in the airway, but we're going to be here. We're going to keep an eye on things. We're going to do this right, and I'm confident you'll be good. You'll be fine. All right, sir. So I'm going to do an assessment. I'm going to listen to your lungs. With your permission, I'm going to go underneath your gown, okay? thank you. And let me back up. I also have a pulse ox, and I'll check your oxygen levels and your heart rate, all right? All right, thank you, sir. So we check their heart rate, their respiratory rate, and their saturations, as well as lung sounds, and keep a note of that. If it's indicated, you can suction the patient. It looks like you're pretty clear up there, so we're not going to do any extra suctioning with a yank cower over there, all right? All right, thank you, sir. So we prepared the work site. With your permission, I'm going to be using a table, okay? I'm going to clean it, and then I'm going to just put my stuff. We'll clean everything out and put it back where you want it. So within the kit, there's a towel. Let me go ahead and open the towel up. Now we'll keep the surface clean. And prior to that, you would go ahead and wipe it down. And go ahead and dump your products into the field. I have a towel. I'm going to put this over your chest. It's going to keep you clean, all right? Prevent some of the gunk that might come out when we do the procedure. All right, thank you, sir. This would have, I can use this as a container. We have the hydroperoxide, and the saline water. You would mix a 50-50 solution, and that's what you're going to be using to clean the soma site. You're going to need at least 4 Q-tips, and it'll be more than what you see here. Once you create your solution, and you'd be using the Q-tips for all the corners. And you would also have a saline solution, and that's what you're going to be using to clean the site. Now you're going to be removing the inner cannula. Usually you're going to have a 3rd container there of just hydroperoxide, and you would be placing that reusable cannula, cleaning it out, and there would be pipe tubing to clean it out, and in this case it's not necessary. All right, sir, I'm going to take out the old dressing, all right? All right, thank you, sir. Dispose of that. And we're going to put on new gloves. Now this is a clean technique, so there's no stir gloves necessary. We're going to be removing the inner cannula. This is a safety feature. Take it out. Don't touch the sink, and you can just simply go ahead and dispose of it. In this particular case, we're not disposing of this is a reusable one, so we're going to put a new one in its place. As I mentioned before, if this happens to be a reusable one, we'll be cleaning it using peroxide solution. I'm going to put a new one in place, all right? Thank you, sir. All right, I'm going to put the, go ahead and clean your site. So I'm going to do this for each corner. We're going to start from the top, and we're going to go from in and out. And I'm sorry, sir, I'm going to get right into your bubble. I'm going to get really close, but we need to get to where we need to go, all right? So I'm going to clean it close to the soma site and then out, and that's to prevent reintroduction of bacteria. Dispose of the Q-tip, pick up a new one, again of the 50-50 solution. Go ahead and go inside there. Dispose of the old one, pick up a new clean one. All right, sir, I'm going to get around and underneath. All right, thank you, sir. In and out. Grab the last one. All right, sir, I'm going to go ahead and clean the last section here. Out. Once we've completed that, we will have at least 4 more Q-tips for the saline water. We're going to take the applicator and we're going to clean away the 50/50 solution, and we're going to go with the same steps. One corner, clean right over here and then away, dispose, grab a new one, clean the area from in and out, dispose, clean the new area and away, dispose of that, and go ahead and clean the last corner and then away. Once that's complete, and go ahead and put the new tie in its place and prepare that. And if you need to, we're gonna sit the patient a little bit or push back down a little bit on and make space behind the neck. All right, sir, I'm gonna get right behind you. I'm gonna get the tie ready for you. And I'd like to go ahead and put one in on one side already. And get that prepped. And with one hand supporting this one right over here, go ahead and remove the tie on the other side. Keep that hand in place. Make sure you grab the correct one. While supporting the trach tubing. And you can go ahead and dispose of the old trach tie, this old one. If you need to readjust your tie, go ahead and do that. All right, so we're just going to get in your bubble again. All right, here we go. And I'd normally check about 2 fingertips and see and make sure it's a proper security on that. Let me tighten that a little bit more. Okay, let's do fingers. All right, thank you, sir. Once we get the new tie in place, we can go ahead and apply the new dressing, the 4x4. And you can use a Q-tip, that's why it's good to have extras, to help you apply the new dressing. I'll use the gentle end here. Same thing on this side. And make it nice and pretty. How are you feeling, sir? Yeah. So typically, patient isn't able to speak, but they are specialized endotracheal tubes. It's called fenestrated tracheal tube, and it has little holes that allows the patient to speak. And there are passomeres that you can attach onto the trach collar and make sure you deflate the cuff so the patient can speak. Otherwise, you can provide them with whiteboards and stuff like that so they can communicate their needs to you. So for bagging purposes, if it's never needed, the ambu bag can go directly and attach right over here. For a rare metal one, there is an adapter needed, and you have to make sure, and you're going to check your charts and you have that with you. Once that is complete, are you comfortable? Let me go ahead and remove the towel and dispose of your products in the appropriate waste bin. Clean your job site and place the table where the patient needs it. The cuff on the trach tube, it's inflated and keeps it in place. It could get deflated or it's not fully inflated. There is a device called a monitor, and this allows you to apply proper amount of pressure. That's 20 to 30 millimeters of water to have it properly inflated. The other manual options is you can have a syringe of air. You can use this little container right over here. Little device here. Sorry about that. I'll fix that, all right. And you can use the syringe to deflate the cuff. It's going to be called minimal occlusion. You would use your stethoscope to listen to your throat, reapply pressure or air until you stop hearing the noise, and you know that's a proper pressure there. The other one is minimal leak, and in this case you would listen and there should be no leak noise, and you would deflate slowly until you just hear the dissipation of air, and then reapply a bit of pressure, and that will stop the leak, and you'll make sure you have a proper pressure there. All right, I'm leaving that in there. All right, sir, are you comfortable? Do you need anything else? You know, we have a trach, we have a call line right here on the side. If you have any questions, if you need anything, please let me know. Somebody will be coming. We're going to be doing auscultation one more time and your vitals once more before I go. So I still have your pulse ox. We'll check your oxygen, your heart rate. I'm going to listen to your lungs once more. Thank you, sir. Let me go on your back up. Take a note of the COCA, consistency, order, amount, and color of the sputum, and see if there's been a change since the previous time a trach care has been done. All right. I'm going to put up your guardrail again. All right, so it'll keep you nice and safe. Those are my gloves. Hand sanitize. Leave the room and chart your findings. So thank you for listening, and have a good day.